Welcome back to Steph Thinks You Should Know, the podcast where we take things that feel confusing, overwhelming, or straight up unnecessary and actually make them make sense. Today we're tackling Medicare, and if your first reaction is, ugh, no thanks, you're exactly who this episode is for. I'm joined by Jared Cooper with Baker's Life, and we are breaking down the real differences between Medicare Advantage and supplements, what people are getting wrong, and what actually matters when you're turning 65 and where things like AI might fit into all of this. This is not a lecture, it's a real conversation with real examples, so you can walk away feeling a little less overwhelmed and a lot more confident. Let's get into it.
Guy said that's a lot of business owners, they are owner operators, so it's if they don't work they don't eat. So the places where you want to go is get it to a part where it's making money when you're not there.
Well, I feel like we are just diving right into this because I do think that I think insurance is one of those industries that it's you could either, be a hustler or it gives you for business owners, it's an opportunity to build something that you could, it could be a legacy or it could be a lifestyle. But there's that growth period where you have to, if you don't work, you don't eat.
Right.
But what happens when the plate is full, but you're still in hustle mode and you've got to get out of hustle mode and now start building the business. And that requires slowing down, which is so hard to do for someone who's been boom, boom, boom.
Hmm.
But this isn't about me, this is about you. Um, and actually, one of the questions I did want to touch upon, and we'll get there later on, is kind of what your goals are in your world and how you see yourself in the next 10, 15, maybe even 20 years. But we'll get to that. Um, and I'm also going to do an intro, so we're just going to dive in. We're going to have editing handle all the transitions. Um, but before we do anything else, I would love for you, Jared Cooper, to give us an idea of who you are and kind of a little bit of your origin story and how you got to Banker's Life and, more specifically Medicare. I know you do some other things and we can talk about that as well, but this is going to be more Medicare based.
Hmm.
But I'd love to hear your story.
Yeah, absolutely. Jared Cooper, that's my name. I work with Bankers Life. How I got into them. So I've been in the industry for a while. I first got into it, I believe it was 2018 with another company I won't name. I didn't really like it. I think it was just the way that company ran it. So I left. And then years later, middle of COVID, really, I was contacted by another, I guess you call it IMO, I guess you call it, where it was a new company. It's been around about 15 years at this point, 16 years, I think. And it's another insurance company, but they're more of a brokerage. So they saw that I had an insurance license back in the day. I let it expire, but what they showed me, I liked it, and I joined them, and I was with them for a couple of years, and then I was also approached again through a recruiter by Bankers Life. So, I heard our um, what's his name? I guess you can call him a manager. He's our top manager for our branch manager, I guess you can say. I had an interview with him, kind of phone interview. Then I came into the office here in Atlanta and sat down with another manager and just saw, compensation plan and all that good stuff and everything that we work with. Medicare being the number, kind of the doorway into doing
Hmm.
other things, and that's something that everyone has to deal with. Most everyone has to deal with, depending on there are some factors that you may not have to deal with Medicare, but and I saw that because it was more um, holistic, I guess you can say. It was not just life insurance. So it was life insurance
Got it.
plus Medicare plus annuities plus financial advisors, So it's an all-encompassing, we can take care of people from the cradle to the grave, basically. So, and again, I saw that it was more holistic in its approach towards helping people, towards sales and things like that. So I was like, I like that better than just okay, here's some life insurance. You could build a team, which is nothing wrong with that. But for me personally, I didn't want to have to deal with having to build a team. Honestly, because I tried that and I was like, man, this
Fair
is
enough.
hard.
Yeah, yeah.
It's hard. It's
It's a
really
totally
hard.
different experience.
Yeah. It's like a good 10 months, and I was like, I had nothing to show for it trying to recruit people. And I didn't really like that. So I switched over to bankers, and then, did all their certification for Medicare and all the other stuff that they do. And I've been with them since. I switched over to bankers last year. But yeah, been with them and pretty enjoying the journey. So yeah.
So I don't think I knew that you did insurance. Maybe you told me there's a lot of conversations, but what got you into doing initially in 2018? What was it that drove you into this world?
Um, I mean, as you know, it's in terms of how they pay, life insurance versus healthcare. I mean, how they pay you is really nice. That's kind of
Hmm.
initially, they pay you for the first year up front without, the client having to pay a full year's worth. They just pay the monthly premium. And I liked how insurance paid initially. That's their, the compensation plan. And really, it's even with life insurance, it's something that people need. Most people don't have $100,000 just sitting there that they could just use towards, burial or whatever. Some people
Right.
do. So I saw it as something that's necessary. Um, and it's, tax free in terms of life insurance. Their beneficiaries don't get taxed on that.
Hmm.
So, yeah, and it's a good way. And if you do a little more research, you see a lot of the super wealthy have life insurance. Like, huh, if they're getting life insurance, what does that tell me? Maybe I should follow how they're doing things,
They must know
Um,
something.
right.
Yeah.
So, yeah, I mean, that's really initially how I got in. I saw, the industry, especially life insurance, has been around for a very long time, hundreds
Hmm.
of years. Some companies, Bankers Life has been around for over 145 years at this point. So it survives all kinds of world devastation like world wars and pandemics and things like that. So apparently they're doing something to, survive, So, and one of the things that I've learned, being in the industry is, especially with life insurance, they say it's recession resistant. I wouldn't
Yeah.
say necessarily it's recession proof, but it's recession resistant. People tend to buy more life insurance, even though maybe, things are looking terrible because I guess they're just in a panic. Like if something happens to me, I want my family to be taken care of.
Right.
Medicare is a little bit different. It's relatively new. I believe it came around back in the 50s or 60s. So that's a little bit different than life insurance or, anything else. So, but yeah, that's kind of how I got into the I guess you can call it financial services industry, even though it's dealing with your health, so.
But at a certain point, it is well, because I know I'm in the health and well, we're both in the health and wellness sphere, but I feel that health insurance, the underage market doesn't get wrapped into the financial portfolio as much as the Medicare does, because Medicare, you've got to have, there's requirements in order for you to qualify for Medicare. And that's a lot of that is making sure that you've paid into the system and that you've got generally they're fiscally responsible folks who are going into the Medicare realm, especially when it comes to the um, supplements
Mhm.
versus the Medicare Advantage. So, well, you do what you do all of it, correct?
Right.
You do Advantage and okay.
Mhm.
Who do you feel like you serve best when it's time to do if someone's enrolling in a plan, are you better? Are you more helpful for someone who's going on an Advantage plan or a supplement? Does that make sense?
Yeah.
Who needs you
You
more?
really, who needs who needs me more?
Yeah.
Well, each situation's different, So I mean, there's people who have money tend to go towards a supplement, but they can also go towards an advantage plan. It just depends on their specific situation. So really, people are people. You know, they're going to do whatever they want to do.
Right.
But people that tend to maybe on the lower income side of things, they tend to go on Advantage plans because a lot of Advantage plans are zero premiums a month, so they don't have to pay
Okay.
anything monthly. Usually, some Advantage plans do have a monthly premium, but a lot of them don't. So, and from my experience, and a lot of my colleagues, a lot of those people, they tend to be kind of fickle, and they just jump around. You know, they'll go to that person, ask them a question, go to that person, ask them a question, go to this. You know,
Yes.
so you have that issue. So you may have a great sit down with that person, great appointment, and sign them up for something, and then someone comes behind you and sells them right underneath you. You know, even though you had a great conversation, you talked about the kid, they told you who all the family is and who whatever, show all your dogs and but it's just but it really just depends. I can't say one's necessarily better or worse than the other. But like I said, people who tend to have a little bit more fiscally responsible tend to go more towards the supplement route because of
Okay.
how it goes. You know, how what supplements do, versus what Advantage plans do. Supplements tend to take care of all of your out of pocket once you pay the deductible.
Hmm.
And then Advantage plans, they have a maximum out of pocket that you have to pay if you're in network, depending on what type of Advantage plan you have. So there's
Right.
a lot of rules, and a lot of regulations, and every plan, on the Advantage side, they cover some things better than other things. Like for instance, some may have a better dental plan, like dental, yeah, a better dental plan than another Advantage plan. They give you more money towards dental, and some may give you less money towards dental and vision. They have great vision, another one has terrible vision. So it just depends, and you have to kind of sit there with the client, figure out what their biggest need is, and say, okay, you can go over here, maybe this, take a look at that. Here's, triplicate of choice. Which one of these looks best for you? Or however it goes.
So I don't, have you done the disc assessment? Do you know what that is?
I
The
don't know.
it's kind of, if you've ever done the Myers-Briggs.
Yep.
Okay, it's kind of like Myers-Briggs, but for more professional development, and it's used to help business owners and leaders understand what their style is so that they can work with their teams.
hmm
Excuse me. It's to be used in conjunction with a business plan kind of thing. But there's several different personality types, and D is for like more of a is a dominant. It stands for dominant, but it's for folks who they don't want to get caught up in the how it works. They just need someone to explain what it is so they can move on. Like
hmm
they're decision fatigued, if that makes sense.
hmm
And I do feel that if when in the insurance world, if we can come in and make it clear and make it like simplify it somehow so they don't have to go down all the rabbit holes because
Right. Yeah.
the least amount of rabbit chasing that we can do, it's a better experience. But
hmm
I find that folks that are on that D personality are the people that I want to work with because they want to be able to know that you can verbalize what's going on in a way that
hmm
they can understand, and then they're fine. And I think that it's the C and S's that that get you in
Right.
trouble because they want to overanalyze, and
Yeah.
they're the ones who are going to pick up the phone and then talk to someone else that may say it in a different tone, in a different way that sparks their confidence and their
hmm
trust. And it's that's one of the things about that disc assessment is helping you understand who you are and then help identify who you're talking to so that you can modify how
hmm
your approach is to their style. Um,
Right.
it's just
I mean, the way that we do it, we have though at least for me and our team, we have a presentation that kind of gives you just the basics of Medicare
right.
because there's a lot of information about Medicare, and we have to be recertified with Medicare every single year. And right now is that time. I'm going through the certification for this next year. So we break it down to basically what Part A looks like Part B, Part C, Part D, and
Hmm.
just the highlights of those different parts. Instead of going through, all right, this is how it affects your specific business that you're a part of, and if it's a small business versus a large business, and because they behave differently with Medicare. So and yeah, it's a lot, inpatient versus outpatient, what it covers, how long it'll cover it. We don't go too much into detail, just the basics of what you need to know. Um,
Right.
but you have the opportunity to go through it. They have, I don't know if I can share my screen or not,
Yeah,
but
hang on a second. You may have to ask for
but
permission.
let me see. I can pull it up. There it is. But I wanted to show you because they send this in the mail towards, I don't know if they send it to every senior every single year, but at least to those who are going to turn 65, they're going to send you this in the mail.
The stack of confusion is what I've heard that be referred to,
Right, right. Can I share or
which
can
is
I?
where AI is not helpful when there's a stack of confusion. To me, this
Mhm.
is where a person is helpful
Right.
because yes, it's too much information that we get. Are you able to?
I said just sent a
Oh, there we go.
request.
Okay.
Okay, I can share now.
Yep.
Okay, you see that? Can you see that?
Yes.
Okay, so they're gonna send people this in the mail. You get a
Yeah.
book. As you can see in the top, it's 128 pages. And and it's all kind of legal medical jargon that most people aren't going to read. I'd say probably 95% of people are not going to read through this book from cover to cover.
Mm-hmm.
So you can see here, Part A is your hospital, Part B is your medical insurance, like going to the doctor and stuff. Part D is your drug. Part C is what call your Medicare Advantage plan, as you can see right here. You have your original Medicare versus your Advantage plan. So a lot of people I come in contact with, they're like, I have no clue what I'm doing. I need someone
Right.
to tell me what this all is about. So we don't go through every single little detail of what this is. And okay, if you were born after this part, you qualify for this. If you're born before that, you're not qualified for. But there's all those kind of rules that with it. So we essentially just bring it down to little small little chunks that that you need to know.
Mm-hmm.
You can make a decision of, okay, this makes sense. I think going this direction with this particular plan will be the best for me, you know. Um, but yeah, so it's just we try to make it simple for people. Um, like, well, that's something different right there. So in terms of Social Security versus railroad benefits. So if you have railroad benefits, you're not going to have Social Security. Yeah.
And I would
So
imagine if you have those railroad benefits, you would know.
right. Yeah.
So, yeah.
But yeah, I mean, they're eligible for Medicare. And you can see right here, if you're under, so Medicare is basically for those that are 65 and above. But there are instances where you qualify for Medicare if you're under 65, and you can see it right here. If you have end stage renal disease, you can qualify for Medicare. Or if you have ALS or Lou Gehrig's disease, then you
Okay.
qualified for
I
Medicare.
didn't know that. That's very
Yeah.
interesting.
Yeah, or if you're on disability for at least 24 months and you get, Social Security disability, then you're eligible. You can be eligible for Medicare. So those are instances when you're under 65, you can be eligible for Medicare.
Can I ask a quick question? If
Sure.
someone is disabled for that amount of time, would they know that they would be qualified for Medicare? Would there have been a conversation somewhere along the line?
Yeah, so usually you'll go on to Social Security,
Mm-hmm.
disability, and I'm sure they'll let you know. I haven't seen that paperwork, but I'm sure they'll let you know after a certain amount of time, which is 24 months, then they'll automatically put you on Medicare.
Okay.
Yeah.
So to me, the 128 page brochure basically is a legal obligation to say everything, but it's not everybody's going to need to know this because it's not relevant to their situation.
Right. Right.
If you're
Yeah.
coming in as aging in at 65 and you've got, there's you just need to get your stuff set up. You don't have a special situation. You don't need to go into all that stuff because that's where we get lost.
Right. You don't need to. I mean, it's there to have it if you're just curious and you want to know. But right, you don't have to go through
Yeah.
all the, yeah. It's a lot to know and remember. And it does
So,
change from year to year.
well,
There
that's
are
the other
some,
thing. Yeah.
yeah. I mean, it doesn't change a whole lot, but there are changes that happen from year to year, like the out of pockets with original Medicare. They went up for this year. You know, they seem to go up every single year. And the prescription drugs, like if they're covered drugs, the amount you pay out of pocket has a maximum, right? I think this year is 2,100. So if it's a covered drug, then the most you'll pay out of the year is 2,100. If it's not a covered drug, who knows? And I worked with a client. She's been a client with Bankers Life for 20 plus years. And we sat down with her this last year in the fall, just kind of reviewing what she had, making sure everything's still good with her and her situation. She had a couple of things with us, but we were reviewing her prescription drugs. And I don't remember the name of the drug, but it was some very important drug. I believe it was for her heart or for her husband. I can't remember. They're both kind of I think in their late 80s, but it was a heart drug. And kid you not, this drug, if she didn't have any kind of special help with this drug, it would have been $90,000 for the year.
What? That's not even a real
Yeah,
price.
it's a real place.
Come on. How does
Right.
someone set that price? Come on.
Yeah, it was like over $90,000 for the year, but she had some sort of what they special help is what they call it with the manufacturer, so they were able to get it at a
Mhm.
much cheaper price. Something like that, prescription drug, a lot of them wouldn't cover that, so you would have to go to the manufacturer and be like, "Hey, I can't afford $90,000 a year for a drug that I need." You know,
Nobody
so
can. That's
right,
fraud. That to
yeah.
me, that's
Right. Yeah. Yeah. There's a lot of things I can say that's like that shouldn't be, but it is
right,
what it
right.
is. Yeah, it was over, and I've heard a lot of other some people, paying $1,000 a month, which is not as bad as 90,000 for the year, but still $1,000 a month, and you're in retirement. That's unfortunately a lot of people only get like $1,500 from Social Security a month,
It's
and that's
criminal.
yeah,
It's
yeah.
criminal. Um, so let me ask you this. We just listened to a couple of podcasts that talked about business succession and this kind of stuff. And we talked
Mhm.
about AI and people using AI instead of, and trusting the feedback that it gives us. And I know, and we all know that people are using AI to download that 128 page document and ask
Mhm.
it questions. What are some, I mean, have you used it? Have you tried to go through it and ask it questions or
No, I
okay,
haven't. But I mean, like I said, we have to get certification with this every year. So
right.
we have that tells everything in that certification for us to know.
But
So
what are people searching for or asking their AI about like maybe I'm not asking this question properly. I'm just curious. I don't want people shopping for insurance without talking to someone because there's
mhm,
all kinds you just there's biases, there's all the things. But
right.
what advice do you have for folks who are using AI to help them with their Medicare selection?
Um, well, I mean, there's a lot of companies offer Medicare. The companies that you work with, they offer, the Advantage plans for elderly folks. So I'm not. That would have to be very, very extremely comprehensive, like what the meeting we just had, where they basically know everything of, our colleague, everything medically speaking. So there would have to be some sort of fusion of the AI that you're using knows your medical history, your prescription history, and then compare that to what all the plans offer.
Right.
There would have to be some sort of union between that. And I don't think most people don't want to just tell some random AI, here's all my medical history. Sure, have it. you know?
Well, that's right now. Let's
Right.
fast forward 5 years.
Right. I mean, I saw a video of I forget his name, but he's a local businessman here in Atlanta. But he was at the doctor's office, and there was like nobody there, and it was all like a kiosk. He, put in his information, he checked in, and then it would tell him, "All
Cool.
right, it's time for your thing. Go up to the doctor." There was no receptionist, no people walking. It was just this building, empty hallway, nobody there. And it just tell him, log in here. All right, you're checked in for your appointment. All right, when the time comes, it'll tell you to go. So I know it's right around the corner where, I mean, maybe we won't have a choice that whether, our information is automatically uploaded so it
Yeah.
can make that recommendation for us. Um, but yeah, I mean, it's a little scary, you know?
And I think that the message that I'm hearing is if you are someone who likes to go and do these deep dives and likes to do all that kind of stuff, do it with caution and make sure you've got someone that you can talk to say, "Hey, I went to take it, my AI told me this," or however
Mhm.
it's worded.
Right.
But I feel like there's going to be a lot of responsibility for us as business or for who are the producers to be able to explain what AI has said. Like take
Mhm.
those, if someone says, well, according to such and such, this says that I this, but you as a person, we still have to have the knowledge to say, yes, that's correct, or that is correct, but not in all circumstances because of such and such and such and such. So if it's all about the prompting. And so if you are someone who's doing searches and if you're not asking the right questions, which actually leads to maybe I wonder if there's a place for folks for us as insurance uh, brokers and just in the financial world to create and share prompts that people could use in order to get the best information. Like if instead of asking what plan should I choose, ask it to ask you questions on how, what questions should I be? I don't know. There's different ways to use it so
Right.
that you're not taking AI away from someone, you're not taking that search away, but you're giving them the tools to ask better questions so they're going to have a better experience.
Mhm.
Again, I'm doing a lot of research on how to create agents through I'm using 365 Copilot now.
Yeah.
Lord help me, Jesus. But
Well, from what I can see, I think some even the companies, the carriers are developing it.
of course they are.
So they're gonna
100%.
get rid of middlemen and then just, I
That's
mean,
why I'm saying, yeah.
they're already coming up with virtual appointments, So, I mean, you can speak with a person, but who knows if it could they get so good that you don't know it's an AI. Is that? And I've thought of it as like it's right now. I think it's really at least with this current older generation that's alive right now. I think they
Hmm.
like human interaction.
Sure.
But with the younger generation, they're already born into AI pretty much.
Yeah.
So it could be they want to talk to someone real or they just want to talk to um an AI, from like if you remember the Star Trek, the was it which one was it? Voyager. The doctor was an AI hologram.
Right. Oh my gosh, I totally forgot about that.
Right?
Yeah.
So that was what, 30 years ago. They're telling the future.
They've been telling us
So
all along.
they've been telling us all along. So I don't know. It could be like I said with that businessman who went to the doctor. It's we're around like right around the corner where they can start projecting AI images where they're like, all right, you're not really talking to a real person, but you're talking to a being of sorts.
Yeah.
But yeah, I'm not a huge I don't deal too much with AI on it personally. I mean,
Okay.
a lot of people do, but me personally, I just like, I'll just leave that to everyone else. So I don't know how that could incorporate because if you got an AI that's learning, is eventually going to know more than anything I can tell, and it's going to remember everything that's it's ever interacted with. You know, every situation of the people that it's all clients and patients it's interacted with, so it can come up with a reasonable plan for people. I don't know. I don't know.
Well, again, I know, and I think that, I mean, John was talking about the law. I mean, law is the same way. I don't want to say, I know the big concern, AI is going to replace people. It's just going to change the way that people are. We're just going to be doing things different. It's kind of like how when computers came in. Well, you're not quite old enough to remember the time without the computer, but I mean, my daughter, all of her pictures were on film. We didn't
Mhm.
have a digital camera,
Right.
and so what's changed in this 25 years has just been huge, and I think that it, it's it's going to happen whether we wanted to or not. And I
Yeah.
feel that if we can at least understand how it works, and I don't know if you experience this working with people that you work with. So much of the financial world and even the health world these days is done virtually. It's
Yeah.
done, you got your portals, you've got there's all kinds of stuff.
Right.
So a lot of what I do, I mean, I've helped so many people learn how to use Zoom because
Mhm.
I do a lot of my business is through Zoom, and
Mhm.
being able to be that kind of that tech support for folks and help give that value to your service as well. It's not just about getting you enrolled and getting all of your things set up,
Right.
but how do you use your technology in order to do the things you want to do?
Mhm.
Um, and I think that it seems like we were making things so complicated in order to do simple things, but it
Right. Yeah. Yeah. I mean, we at Bangers we tend to do things still in person. We go to
mhm,
people's houses, or they can come into the office, or we can meet them at another location. We do also do things virtually. And the other previous company I was with, it was all virtual. So it was everything that we did was virtual, you know, helping the people sign on to Zoom. Usually at least it used to be easy to do Zoom. You just send them a link, they click on the link and it pops up. Now I think you have
mhm,
to like register now for whatever reason.
right.
But yeah, I mean it's the whole process. We try to make it as simple as possible because if you bog them down with analysis paralysis, they're not going to do anything with you that day, and that's fine. But
That's exactly it.
yeah,
That
but a
is,
lot of yeah, a lot of people get bogged down with so much information. That's why we in our presentation it's highlights the major things you need to know, but it's
yeah,
not every single thing you need to know. Like okay, it'll cover all these things, but it's not going to cover this. If you go, we just leave that to the book if you want to read the book. Or you can do download it online like I have right here.
right,
So we try to keep it as simple as possible because a lot of people just get bogged down with information. You know, they're flooded with information every day, you know, thousands of times a day, you know, and we don't want to add to that, you know, just or at least add to the minimal amount that we need to so they can understand, okay, this is what I can expect going on to
right.
Medicare, you
Yeah,
know, or using. So in terms of advantage plans, even with supplements, they advance that company, say Aetna, you know, we sign them up for an Aetna plan. Aetna is going to send them a book in the mail with everything that they cover, you
right.
know, and they'll have an online portal they can log into, get all that information. They can call
Mhm.
in like, hey, I'm getting this procedure done. Are you guys going to be able to cover it? They'll be able to tell them if they called in to Aetna. So there's different resources we can show them how to get the information they need to get instead of trying to give it all to them all at one time.
And I think that's a great, it- it's not necessary because you're right. People will forget everything that you've told them until they need something. And then, but if you know where to go when you need something, that's key right there.
Hmm.
And yes, and that's with Medicare. To me, that's one of the scary things is if there is an issue. I've in my past history with dealing with not that I've been on Medicare, but dealing with Medicare clients and things. if there is a problem, it's not always so simple to call and get resolution. Is
Mhm.
that is that still common? I mean, do you feel like if or do you run into a lot of disputes with Medicare? Like, is it the claims like refer
Um,
kind of thing? It's probably a little different than
yeah, it depends, I guess. I had a client earlier. Well, I think he figured it out because he hadn't called me back. So because I signed him up for something and he needed to get, I think, some minor surgery. I can't remember what it was, but um, I think he had been with a certain doctor for the longest time, 20 plus years, and he wanted to keep that doctor, but that doctor didn't take um the plan, that
right.
particular plan. So some people may go ahead and deal with it, like, okay, my doctor doesn't take this plan, that's fine. I'll have to find another doctor that does, you know.
Mhm.
Some people are okay with that. Some people want to keep their person because they know everything about them, they know their life history. But in terms of people claims, I mean, so far I haven't had to deal with any kind of claims. I
Okay.
know colleagues that have, in terms of, oh, this person said this, but when I called them, they said they didn't, you know. So luckily, so far, I haven't had to deal with that. I mean, I'm sure I probably will at some point. So when people just kind of get in their own head of they interpret what you say a little bit different than what you
Oh
actually
yeah.
said, you know.
Yep.
So yeah, I mean, like I said at the beginning, people are people,
People
you
are
know.
people.
They
That's
hear
right.
what they hear what they want to hear. They don't do the due diligence and whenever they are sent the information to kind of at least scan through it to
Yeah.
see exactly. I mean, the people know what they're going through. You only know what they tell you. So, like, if you know you have this issue, you should probably let that agent know, hey, I have this issue, and that agent be like, okay, let's go with this plan. This plan, let's look at this plan. This plan covers this issue a little bit better than this other plan. Like some plans are better at covering, let's say, high blood pressure. There's certain incentives going on another plan for high blood pressure or not,
Hmm.
high blood pressure. I'm trying to think of a condition. But some companies cover, some plans cover certain conditions better than another company would, and
Okay.
they'll yeah. So that whole process, that we try to do our best, asking the right kind of questions with when we sit with the clients, but sometimes they forget that they when you ask them, like, oh,
Right.
I'm doing great, but I have like 7 medications that I'm taking. You're like, you're not really doing great. You may be feeling okay right now, but you're on 7 medications. You got something wrong. You got things wrong with you.
Right.
Um, so it's just really, like I said, letting them know the basics, and then so a lot of times we give them we try to make it's not just a transactional thing. So
Hmm.
it's an ongoing relationship. So yeah, like I said, I signed a client up for a thing. He called me this year. He's like, hey, I'm looking for a certain kind of specialist. And I'm like, okay, it's not really my job to do that, but I did it. So I found uh, I think 2 or 3 specialists in his area that took his insurance, and I was like, "Here's some three options. Call them to see what they can do for you." So I did. I went above and beyond what was technically my job description, and
Yeah.
helped him out a little bit further. So, and we do that. It just depends case by case. Some people will blow up your phone.
You got to
You
set the
know,
expectations. Yes.
yeah. Some
Yes.
people will go overboard, but for this, I had a couple sit downs with this couple, and they, we're good. They like me, I like them. So like he asked me a simple question, I helped him out. So, and I haven't heard anything, so I'm guessing that he's probably all right. But
So going to doctor selection, and it's my understanding that if you're on a Medicare, original Medicare with a supplement, that's a standard plan that is taken. If a doctor is taking Medicare, they're going to take, it doesn't matter what company your supplement is with, it's a standard supplement.
right, yeah,
Medicare Advantage is where you run into the networks
yeah,
and
you have
you, okay.
networks, yeah.
So
I
I,
mean, yeah, I mean, every state may have slightly different rules than another.
yeah, which they
And
do.
yeah, and
Each state's
certain
different.
counties might have certain things different from another county. But yeah, for Georgia, pretty much it's PPOs or HMOs. There are some other types of plans out there, but those are the main ones, PPOs and HMOs for Advantage plans. Supplements, hours. I mean, every supplement from depending on whatever company you go to, they have to provide the same thing. The only difference is cost.
Hmm.
Hours, we may have additional benefits like silver sneakers. That's
Okay.
kind of free gym membership for seniors.
Silver
Pretty
sneakers.
cool.
That's so cute.
Yeah. So we have that. Some companies may not have that. So,
Okay.
but
So that
they
would create the price variance then. That would explain why some plans may be
possibly,
okay.
possibly.
Is there a large difference in pricing?
There can be. We're bankers, we're kind of in the middle of,
Okay.
we're not super expensive, we're not the cheapest. But from our research, because every plan goes up seemingly every year. Um, and I'm sure you've seen it on the under 65. But this year, um, ours are going to go up this next month, July. So here's June 30th. Ours are going to go all going to go up July 1st, tomorrow.
Gosh.
So our price increase is nine, right at the edge, not quite 10%, but we're close. So 9.9%, I think it is. We haven't seen double digit increases in at least 20 years. Other companies are not so lucky because of how they price things. Or
Okay.
some may come in real low, thinking, oh,
Um,
we're gonna get a lot of business. And then over the course of time, they may jump 20% the next year and maybe 15% the next, another 17%. So they may come in real cheap thinking they're gonna dominate the market. And maybe they do take a big chunk, but they screw over their clients in the long run because they don't stay the cheapest.
well, and they probably can't afford all the claims that start coming in.
Right. So they have to readjust when all the claims come in,
Yep.
they got to raise them rates to be able to take care of those claims.
Yep.
So, but luckily for us, we've kept it under 10% for at least 20 years.
Well, and that's
So
huge because you're dealing
yeah,
with a sector of the population that's not working anymore. Like it's a
right,
fixed income. Even if you've got, I mean, you've got a set amount of money, but financial planning is a huge part of that because you're not working anymore. So
right.
those
Yeah.
increases are, yeah, that's,
Yeah, and that's a beautiful thing about supplements. If I could recommend, if you have the money to do it, I'd say go for a supplement.
yeah.
Whatever company you choose, I'd say go for a Plan G, Plan N,
Hmm.
even a high deductible Plan G, because they pay for pretty much everything. Everything that Medicare covers, they're going to take care of the rest of it on top of,
Right.
on top of that. And it's nationwide. So you buy a supplement in Georgia, you go and move to Oregon, it's going to cover you over there in Oregon, right? So with an Advantage plan, you're especially with an HMO, you're going to be relegated to being in that specific network, that county, or maybe even city, and it has to be providers in that. Um, just lost the word,
In the network.
in that network. If you go
Hmm.
outside the network, you might not have coverage. Most likely, you won't have coverage. You
Yeah.
would have to be referred by your doctor to go see a specialist outside the network for them to cover any of it. But if they don't, you're not going to see any kind of help. You'll be out of pocket.
And general,
PPOs, yeah, PPOs give you a little bit more um, wiggle room in terms of if you're in network versus out of network. You'll
right.
pay more, but there'll be a cap to what you have to pay for your outside of network.
Yeah.
So yeah.
Oh, gosh. All right. So let me ask you this.
Mhm.
What is one of the biggest Medicare myths out there that you've heard and you could either verify or deny?
Medicare myths. Um,
Or are there Medicare myths?
I'm sure there are. I'm trying to think. and it's not a myth per se, but I've had someone say, "Oh, I have a supplement," and then you go look at their plan. It's like, no, this is an Advantage plan. They, I don't know who told
Oh,
you that this was a supplement, but this is an Advantage plan.
oh, dang.
Yeah.
That's
Um,
huge.
yeah, they're very different. They're very different.
Oh,
So,
man.
as long as you don't have any major health issues, you're just okay. I'm not paying anything at all with an Advantage plan. But if you start having issues, then you're gonna be paying, 6,000 to $14,000 out of the year for your medical expenses.
So right now, I've got a few of my clients that I've had for years and years, and they're about a year and a half out of aging into Medicare. Um, oh, I just lost my question. Oh, right now, and I don't know if you're able to give like a ballpark of the cost, but I've got
Hmm.
one couple that right now their plan off market is about, I think it's like 15 or 1600 a month for the
Hmm.
two of them. How does that compare to if they went on to the original Medicare and went on to supplement? Are you
Yeah.
able to kind of ball and high
Yeah.
income, so
Right. In the higher income?
and
Okay,
a
let's
higher
see.
income? Yeah.
Um, Let me see if I can pull up something real quick. So the Part B premium, so Part B, there is a premium for everybody,
Hmm.
unless there's certain circumstances where there aren't. But most people are going to pay for right now, this year, it's $202.90 for
Okay.
that, for the Part B premium.
Okay.
If you, as a couple, if you make over 218,000, I believe is the number this year. If you make over that, you're going to be paying close to $400 a month per person for
Okay.
Part B. And it's tiered on versus, it's tiered on, let me see. I had it pulled up. I may have deleted it. But it's tiered per tax bracket.
Okay.
Yeah. So say, let me pull it. Let me pull it up. Part B premium based on income.
So if they're under that 218,000, then it would be about 200 and you said 220?
Yeah, 202
Go to?
and some
Okay.
change. 202 and some change. Um, I must have put it on my different device. I had scale because I had it so because I was kind of okay. Is this it? Yeah. Yeah, let me try to share my screen again.
All right.
Um, Share. So you can Google this. This is Social Security.
Could I use my
Uh,
AI to? Okay.
sure. This is Social Security. So this is Part B premium versus drug costs. So I believe the number is 209 this year. So if you make over 209 as an individual, so you're going to be paying about, 284 for your Part B
Okay.
premium. And then there is another thing that I learned this year because I switched a client over. She had a premium or she had a supplement already. She's been on Medicare. I think she's 72. She's been on it for a couple years now, but she had a regular Plan G. And then I switched her to a high deductible Plan G, which is significantly lower in cost,
Okay.
but you have a higher deductible,
Okay.
like uh 3,000, I think it is. So if you're making more than this much, or if you're making between 109 and 137 as an individual, they're going to automatically give you a premium for your drug coverage. If you're under that, you're not going to have any premium unless you have taken drugs. She's not taking any drugs, so her premium is going to be $14 a year for her drugs. But this is
Okay.
her Part B premium. If you're making 137 as an individual, between 137 and 171, this is what your premium is going to be. 404, 405 and some change.
Okay.
And so on and so forth. And filing jointly, so it's between 218. Okay, these are right. Yeah, 218 and 274. You're gonna be paying about this. 284 per person
per
a
person.
month.
Okay.
Yeah. And you can see the different tiers. The more money you make, the more they stick it to you.
Well, of course.
So,
I mean, don't even worry about getting successful and making money because we're going to have come and take it all. Well, this is very helpful because if based on looking at these, okay, so a plan G, just what's the
yeah. So right now for a plan G for a male, it is, I believe it's 194. Let me double check that.
okay. And I don't need exact numbers. I'm just trying to see if they're what the what that their rates are going to look like in the next few years because I've been giving a lot
Right.
of people some hope that
Yeah. I mean,
hang on
they're,
until Medicare because that's
yeah, if they're paying out of pocket for like your services versus, going on to Medicare, they're definitely going to most likely pay or save some money.
yeah.
Yeah, so for male, it's about 194 and some change, and then for
Okay.
females, 175 and some change for Plan G. Um, and like I said, some companies are more than that, and some companies are less than that. So the difference is, we like to say, is because you'll have our personal interaction. You have someone to call if you need something, instead of
That's
having to,
huge.
yeah, instead of having to get on a 1-800 number, call your company, hey, and you sitting there for 30 minutes or whatever. Yeah,
About the cost difference. I kind of did a just a general rate, and it looks like the folks that are paying between 14 and 1500 right now,
hmm,
if they qualify, if they're within the first age bracket or income bracket, they're looking at a between for the both of them about 938 for their original and then their supplement.
yeah,
So that's a pretty significant savings that I think they're going to see in the next.
right, yeah. And there's another thing you should be aware of. So for them to determine where you fall on that Part B premium, they
Yeah,
look back 2 years.
interesting.
Yeah, so if they can,
Oh,
if they can lower their income, I don't know if that'll help, but if they
Jared,
get,
that's huge.
yeah,
Please share that PSA with everyone that we
yeah.
that's a
So
huge thing.
to determine what you're going to be paying for your Part B premium, they look back 2 years and what you filed in your taxes.
Wow.
So if you're signing up for Medicare here in 2026, they're going to look at 2024.
And I'm guessing that Banker's Life can help you figure out how to diversify your portfolio so that you can manage your money properly and then
Yeah,
still show the income in order for you to uh, get the most benefits.
right. Yeah. Well, we full, what you call it? I lost the term. Full financial planning company. Now
Yeah.
we pretty much do all of it.
And I think that may be where the Medicare is that falls more into that financial planning because there's in order to get into Medicare and have that be what you sense that into, you got to make sure your finances are in order because a lot of it's based on what your finances look like.
Right.
Yeah.
So yeah, there's for seniors, the number, what I'm trying to say. So a lot of seniors go bankrupt in retirement because of medical expenses.
Mm-hmm.
If they don't have it set up correctly, they can easily drain their 401k because of medical, especially when it comes to long-term care,
Yeah.
things like that. I think the average or the minimal cost, I think, for long-term care, like a nursing home or having someone come to your house to take care of you, is like 40 to 50,000 a year. That can drain if you have, $500,000 in a 401k, that can be done in, 5, 6 years. So if you don't plan for that, you could be up the creek, and have to get on the Medicaid, which a lot of people don't want to get there, but a lot of people have to go on it.
Yeah. And right now we have those programs. Who knows what they're going to look like in another 5 to 10 years as well.
Right.
That's the other thing.
They might be trying to drain Medicaid right now. I mean, there's been a lot of changes with the big, beautiful bill. Not exactly sure how everything's going to be affected in the long term.
Yeah.
But yeah, sounded, from what I heard, sound like they cut some things. So yeah,
I'm so glad it's not my job to fix the healthcare system. I'm just
right.
because there's so many layers and levels that it's exhausting to think about. But
Yeah,
it sounds like to me the biggest takeaway is if you are, I mean, kind of like if you're a business owner, you've got to figure out how to your succession plan. If you're a
yeah,
person and you're planning to live past 65, you have to figure out how you're going to pay for your health care. And I imagine that conversation does need to start not 2 months before you turn 65,
right, right.
but maybe at least 2 years. And I mean, like, at what age do we start having that conversation? Who do you like? Who needs to? When do we start thinking about it for real? Like, really not getting into it versus
Yeah.
saying it's so far away.
Um, Man, I talked with Steve. He is on Medicare, and he for him, because he's got a different kind of personality, he started looking, I think, like you said, 2, 3 years beforehand.
Yeah,
So but I think he has that kind of mind that thinks
right.
that way. So that would be a good time to start talking about it, get in touch with somebody. But yeah, well, a lot of people I talk to have started at least thinking about it.
Yeah.
Whether they actively are looking at things, researching is another story. But yeah, I mean, here's the thing though. So if someone has work insurance, they can stay on the work insurance depending on kind of company.
Hmm.
But I think most or a lot of people can stay on their work insurance if their company provides it, and that's perfectly fine. There aren't any penalties involved if you stay on your work insurance. I guess one thing I could share. If you don't go on Medicare when you're supposed to, and you don't have any kind of credible coverage, or you just have a private plan, they're gonna penalize you for every 12 months you're not on Medicare. It's a 10% penalty, and it's permanent. So. Um, but yeah,
Why
so
wouldn't you though? I mean, why wouldn't you go on Medicare? Or why would you self-insure like
yeah, why would you self-insure?
yeah.
Yeah, I don't know
I don't
because
even know if you can actually.
no,
I
you
don't
can't because the cost would be astronomical.
well, in a lot of those plans, you have to be 64 and a half or younger in order to enroll
Right,
because they don't
right.
want to touch you after you're turned
Yeah, I
65.
mean,
Yeah,
think about it. Your body's like a car. The longer it runs, the more it breaks down, the more services you have to go through.
right.
Our bodies are the same way. So you're going to use your medical insurance for most people as you get older. Some people use it more when they're younger for various reasons, but as you get older, you're definitely going to use your medical insurance because we
Well,
just fall apart.
and you've been paying into this for
Right.
a very long time. I mean, and that's one of the have you, was it 10 years?
At least
Yeah,
10 years, 40 quarters.
right.
Yeah.
So you've already contributed to the system. It's time now to get enrolled in it. And I think it's just the problem is the cost of everything has just gone up so much. And especially when you're using insurance to pay for stuff, it doesn't, it's just that's a topic for a different podcast because we could go on and
Yeah.
on about all that.
Right.
But my biggest takeaway here is have the conversation maybe 3 years because so much can change as well. You don't want to
Yeah.
what's relevant now may not be relevant another year and a half, 2 years. But
Yeah.
you at
Right.
least are familiar and can ask educated questions. But I
Mhm.
also imagine not doing this by yourself, connecting with an advisor. Does it cost anything to work with you?
No, just to sit down and have a conversation and go through what Medicare does doesn't cost anything.
Right.
It
Does it
doesn't just
cost anyone to enroll in Medicare through you?
um so enrolling in Medicare, you can do that on ssa.gov. That's
Okay.
where
Oh, right.
that's where you sign up for Medicare, and they'll tell you exactly how much your Part B premium is going to be. Um, so Part A is for most people who have worked at least 10 years, 40
Hmm.
quarters, is going to be free. Some people they might have a premium because they didn't work. Or they so if you're married, if you're stay-at-home wife and you've never really worked, then if your spouse worked, then you'll qualify for Part A.
Okay.
Well, it's entitled to Part A is what they call it. But if you're like an immigrant, say, and you come here, work a few years, because I just talked with someone the other day, his his family immigrated here years ago, but his parents really they didn't work. They worked for a little bit. I think they had their own business. They worked for a little bit, maybe like
Hmm.
7 years. So they don't qualify, or they don't qualify for free Part A. They can still get it, but they have to pay for it. And I think it's like $400 for Part A. Part B, you qualify just by paying for it because you pay for it. So I forgot where I was going with this.
Okay.
But yeah, so it's
That's
just
a
like,
good.
oh yeah, okay. So you can sign up for Part A, Part B on SSA.gov, Social Security Administration. You can sign up there, and they have how you pay for it. So if you're not on Social Security, if you don't go on to Social Security, they're going to send you a bill in the mail, and it's going to be 3 months worth. You can get them to change it to every monthly, but initially they're going to send it 3 months worth. Um, if you're on Social Security, it's going to automatically come out of your Social Security check, your Part B premium.
Okay. Right.
Yeah, it's automatically. So, say you start taking Social Security, it's your when you're first eligible, was that like 62, I think, now? So you're on Social Security, but you're still working. Once you turn 65, they're automatically going to put you on Medicare,
Hmm.
and then they're going to start deducting Part B premium from your Social Security check.
Right.
So, if you decide you don't want to go on Medicare at 65, you can stay on your employer. It has to be employer insurance.
Right.
It has to
Yes.
be employer.
Yep.
Or if you own a business and you're getting your insurance through that, then you can also stay on that as well.
Hmm.
Um, but it has to be employer insurance. You can delay your Part B. You can delay your Part B for later. You just have to do some extra paperwork for that. But you can enroll in Part A because it's free for most people. So,
The other thing that just came to mind, and because we are part of an organization that is made up of business owners and a lot of small business owners, and especially business owners who are looking to grow their business and hire people, is setting their not only themselves but also their employees up for success. Because as a business owner, it's your responsibility to deduct uh, these contributions to
mhm,
payroll. And this is one of the things I'm cleaning up right now. I've got plenty of time on the books for Medicare. I mean, I've worked I've never been independent until now. So,
mhm,
but I know that once set up, when I get my payroll and everything set up, that's going to be part of my deductions. I'm going to start doing all that again. But a lot of business owners don't do that
mhm.
especially if they're starting out,
Yeah,
because that's extra money that they don't have to give away quite yet. So
right.
they're in the hustle, and they're just, when money comes in, it's like it's a, uh, I can't think of the word I'm looking for. But what business owners need to keep in mind is when they set up their business, to make sure that they are qualifying their employees for these types of programs later on down the line. Um,
Mhm,
especially small, like mechanics or
mhm,
places where you've got people that work there for a very long time. Loyalty is huge,
right.
but you want to make sure that you're doing everything because to me, that's one of the things that I've discovered over the years is the benefits that we would get through employers. It
Mhm,
wasn't just, oh, I have health insurance or
mhm,
I have retirement. It's the benefit of that discipline of putting money aside and planning for the future. It's hard to do that when you're in the middle of it. But
right.
as
Yeah.
a business owner, that's a huge huge asset that you can. you can provide your business. And well, anyway, I hadn't really thought about the folks that, especially young folks who were coming right out of school and not getting a corporate job and not
Right.
getting group benefits.
Yeah.
Huh, yeah. So
Yeah, that's true.
they need to be working with financial advisors to make sure that they've got their thing,
Yeah.
especially as their business grows. And if it does turn into something more than just, I'm driving a truck around and looking for jobs. They've
Yeah.
got an actual
Yeah,
business.
I would say, yeah, they need to get in touch with especially a good CPA. A good CPA would, I think, probably should know all that stuff because I mean that's tax related, especially with
Right.
taking out taxes for Medicare, taking out taxes for Social Security,
Mhm.
and whatever else they take out for. But yeah, I mean, I think I would say there are different rules for business owners. 'Cause I think at least I have a friend, his wife, like I think she like sold some pastries or something, and they did taxes like every month. You know, I don't know how you do it, but I don't know, you can do it every month or every quarter. A lot of businesses do. So I would say if you have a good CPA, they should be letting you know about all these different things, you know. Like I guess this depends on what kind of business you're in. Um,
Well, I
yeah,
guess it's just a matter of, are you doing payroll, or, are you, but if you have it set up properly. But
yeah,
if, and again, I think there's so many things that are not taught in school, or that are taught in school that are not relevant when you get out of school and you forget all about. And if you're not,
right,
depending on which track you go to, but the gig work is becoming a huge thing.
right,
And people are leaving corporate and they're going off, and I mean, there's always going to be corporate folks, but there's a large sector of folks who are not doing things the way things used to be done. And
mhm,
because of that, they may not be aware of systems that were in place that they were being protected with, that they didn't realize they had. So there's I think just, and that's just part of being a business owner, and
mhm,
understanding that if you're going to take on that responsibility, then there are things that you are going to have to do. It's not just about, oh, I'm going to be, no, in a business. It's no, you're going to buy into a lot of stuff and have to go through what it takes to be a properly run organization, or
right,
it's not going to work. I mean, it's going to fall apart. Um, so, which is when you call Juliet and have her come and help you. She's a good life coach. She could get you to the right person to get you through all the things. But you're right. I think a good CPA for and how do you choose a good CPA? I mean, that's a whole nother industry that
yeah,
it's like a mechanic. I think
mhm,
anytime you are in a industry there's where it's not like a normal everyday occurrence, like painting. I keep going to painting, but it's there's certain things that it's just it's an everyday need that we have, that we understand.
mhm.
Insurance and financial, that's a whole, there's so many
Yeah.
caveats and it can get confusing.
Yeah, I mean that's something like you said. There's a lot of things that they should be teaching us in school, but they don't. Maybe that's by design. We can
You
go.
want to dive into that, huh?
We can talk at nauseam
Oh,
about
for
that.
sure. That'll be
So
our next discussion.
yeah, so people being independently wealthy, yeah, they don't. That's yeah. Anyway,
Well, the other reality is that, my daughter's 26 years old. What is Medicare going to look like when she is, in what, 40 years? What is it going to look like in 40 years? Are we paying into a system that's not even going to be there? Like
right.
all those,
Like Social Security.
yeah.
I don't. Well. Yeah, I don't know. That's a good question. That's a good question because the cost of Medicare is going up, like in terms of the out of pockets, even in the, like I said, the Part B premium. It
Yeah.
was 185 last year. Now it's 202 this year.
Yeah.
So it's a what, over
Significant.
10% hike in cost?
Yeah.
If it goes up 10% every single year, what is that going to be? And so who knows?
Again, I feel like we could have this conversation could go on and on, but
Yeah.
what I've seen in the underage market is a lot more self-pay model, a lot more direct primary care. People aren't, you've got providers that are not taking insurance anymore. They'd rather not deal with it and just do the self-pay because that
Yeah.
they don't have to deal with bill balance. I know right up the street from me, there is actually a direct primary care for seniors. They do
Hmm.
take the supplement, they take supplements and they take Advantage. But I believe that, well, one, you can get an appointment. It's just a lot easier to get an appointment in those places. But I think that direct primary care is going to be very interesting to see develop over the next few years as it pertains to senior care. Um,
Hmm.
because like to your point, seniors tend to we get well, I'm almost a senior, but we tend to hurt ourselves a little bit. We're more likely, we're higher risk, higher
Right.
risk.
Right.
But it's there's also I feel that the generation that's going into the Medicare right now is a little different than I'm 53, so I'm less than a little over 10 years away. But I know that lifestyle has changed. And
Hmm.
so people are doing health, they're getting their health care done differently. Like they're using different types of services. They're not going to
Hmm.
traditional doctors or,
Yeah.
it's so to see where that goes and how that ties into Medicare and how we're paying for our health care as we in the next 10, 15 years. Because we're actually not training, but there's a group of folks that's going to be aging in that are not used to having insurance because there's a lot of people going uninsured now. Either they
Hmm.
can't afford it. I mean, well, one, they can't afford it, or two, well, there's a lot of different reasons.
Right.
But the whole landscape of all of that is just so I feel like it's hit such a weird peak that so much is going to be it's going to look completely different. It's going to break and we're going to have to rebuild it. And we're going to see that to me happen over the next 10 years, I think.
Yeah. Yeah, I'd say that there's, especially the American health system, it's crazy. I mean, I take Spanish lessons from a Argentinian. So she lives in Argentina, and how they do Medicare, or not Medicare, but health insurance down there, it's doctors don't get paid like they do here. It's a
Hmm.
big business being a doctor here in America, you know. Down there, I mean, they get paid, decent living, but it's not like $1 million a year, for being a doctor.
Yeah.
So I like for like general care, of course, their taxes might be higher, to be able to for people to get low cost or free general care.
Hmm.
And then may have a cost they have to pay for doing a specialist or hospital visit or whatever. I don't know exactly, but um, yeah, this the way we do healthcare here is not very sustainable. You know,
Well, and
it
yeah.
because the cost of things has to do with providers negotiating with insurance companies plus pharmaceutical companies.
Yes.
And depending on what you believe and what you heard, about pharmaceuticals and stuff like that, I mean, they're in it to make a profit,
Yeah.
you know? So
Well, they're in it to show a profit.
show a profit, yeah.
I mean,
Yeah.
they can charge
So
90,000, but they're really only making $10 because they're but they that's a business model. That's a subscription type of thing where the business can show that they're more valuable, but they've got programs that can help people who can't pay for it. I mean,
right.
it's
Yeah,
a
it's
scam.
kind of strange. kind of
Yeah,
strange. Yeah. Yeah,
yeah,
that was weird. I was like typing and that was in 90, I think it was like 93,000. I was like, what? And it
yeah.
says, yeah, she gets some sort of arrangement with the manufacturer. She's only paying very little, whatever it was, you know? It's like, how is that even? Yeah, a lot of things are way overpriced than what they should be.
A-
So,
And I
but
do also feel that our country is way too big to have universal health care because we'd have to have it for it'd have to be the same in every state, and we're too big of a we're too big. But
yeah,
it's
300 and what, 350 million people? Somewhere
I
around
think that the this past year with the open enrollment, when the subsidies didn't go away, they just didn't keep up with I think that the carriers thought that the government was going to say, you know what, you're right, we should increase the subsidies so that people don't lose health care. So the insurance companies raised their rates
there.
tremendously,
Yeah, yeah.
but the subsidies didn't keep up with that increase. And that's
Mm,
not really the fault of the government. That's the fault of the insurance companies. And again, I'm a broker, so I can say this, but I think that we've abused the system and there's just been so much fraud. And that's why I know that there's talk about taking brokers out of ACA and not allowing them to write for ACA anymore
yeah.
because there's just been there's too much fraud.
Yeah, there's been a lot of Medicare fraud.
Yeah,
So, I mean, that's why there's so many regulations, and that's why we have to be recertified every year.
which
So,
bring it back to the point, if you're in this and you're looking for answers and you have questions, go to someone, talk to
yeah,
someone. And to me, if someone is willing to come and talk to you face to face, that's the person you want to talk to.
yeah,
This whole phone thing, and I know we've got to hang out this interview's gone on a lot longer than I expected, but that's all right.
yeah.
But one last thing that we'll cut this down or shut this down. But you're not allowed to call people to talk about insurance or talk about Medicare. They have to approach you. Is that correct? Like if I were to make a connection to you for you, they would have to reach out to you.
Um,
Or how does that work?
how can I say this? So if you're like if you're because the way we go about it is we educate people, um, and we're a broker.
Right.
So we're not beholden to any one company.
Hmm.
So, yeah, there are regulations if like can't go door to door talking about Medicare. Um, there are ways around it. There are ways around it. So, I mean, we're retirement planning. We because supplements don't have the same kind of regulations as Advantage plans do.
Okay.
So we do offer supplements. I mean, they cover everything, so it's a good investment, I guess you
Yeah.
could say. Um, I mean, advantage plans they have their pluses as well.
Sure.
So, but we go we what's the word I'm looking for? I'm gonna say we go in for through education. Like I said, they
Yeah.
don't have to do any business with us. We can say, okay, this is what Medicare is. Here are your different options. You want to do business with us? Great. If not, okay, call us back. You know, so
But you're not cold calling people and talking to people. Is I felt like there was some sort of regulation against.
yeah, you have to have what's called a scope, and
Okay.
when it's for an advantage plan with a supplement, you don't need a
Oh,
scope.
you don't. Okay. Okay.
But with the advantage plan, they just changed it this year. It used to be when you call someone to schedule an appointment, well, they'd call you. You have to fill out a scope, you know, and you have to wait 24 or 48 hours before you can go do that appointment. Now
Okay.
you don't have to do that anymore.
Oh,
So you can
interesting.
do a scope the same day and go and do the appointment.
Okay.
That just recently, like within the last month or two, just changed. It's like,
Wow.
oh, fantastic. So there's certain regulations. events you can do. I mean, if someone walks into your office off the street, you can because it's a walk-in, you can
Sure.
sign them up right then and there. Um, I mean, but now with the change of the scope thing, that kind of doesn't matter anymore.
Okay.
So, and really, that's just to protect both you and the client. To have a
Yeah.
paper trail of making sure that you're doing the things the right way.
Well, there's that fraud again. And I know
Yeah,
seniors
there's
are a huge target for fraud.
yeah. I mean, because their cognitive starts to decline as they get older. So
Mm,
I totally understand it. Why there's so
careful.
many. Yeah. There's some issues that happen, but that's
Yeah,
why
absolutely.
there's so many regulations just to protect them because they're vulnerable. So yeah, that's why. But
Yeah.
yeah, I
Well,
mean, yeah, I mean, in terms of w- we have advertising campaigns. Um, so especially if we send out a mailer, they mail it back, or if they
mhm,
respond to something online saying they want someone to contact them.
right. Right. You kind of have to ask for that permission.
So yeah, yeah, there's kind of, I mean, that's technically a warm lead. But yeah, you're still random person calling another random person. So
Yeah.
it's like, hey, you filled out this thing, or you reached out to one of our online ads or something. So
Which is so hard for me to even be, I don't even know if I could use that line because even if I did send out something and someone sent something back, when I first started in this industry, that was what they would tell us to say.
mhm.
Like, oh, I received a request that you were looking for. I never received a request. No one ever, I didn't get any
Right.
piece. So there was so much lying at the beginning of,
Right. Yeah.
which
Yeah.
is why I went off on it, my own little path. But I do know that, especially with the senior market, there are a lot of things in place and making sure that they're not taking advantage of it. And especially now with all the scams and there's
Oh
just so
yeah.
much there.
There's a lot. Yeah.
And
Yeah.
people are used to doing things virtually now because, we had a year and a half where we couldn't go anywhere. So it kind
Right.
of it, yeah, it's good that we have these protections. But
Hmm.
all right. Is there anything else before we go? Is there anything else that you wanted to share? Do you have I'd love to, if you have a quote that you'd love to share that you sort of live by,
A quote that I live by.
that you live by.
Um,
What is Jared's quote?
I don't know if I have one. I mean, I've seen a lot of great quotes out there, but I never really committed them to memory. I guess if you could say with a Thomas, if first you don't succeed, try again. The little engine that could.
Yeah,
I don't know. I don't know.
that's a good. Have you seen Spider-Man Into the Spider-Verse?
Yeah,
You fall, if you fall down, you got to get back up. I mean, that's
right.
if you don't succeed at first, try again.
Yeah, yeah. I mean, you got
Yeah.
to figure out what works for you. Because I find that what what someone else is successful at may not be what you're going to be successful at. So you might give
Well,
it a try and see. And then if you find out like, this really ain't for me, then try something else.
but you tried. That's the part you tried. And
Right.
yeah. All
Yeah.
right.
Yeah. Thing is just to keep on moving, keep going.
Livin. All
Yeah.
right. Well, listen, Jared, I really appreciate you doing this with me today. And I look forward to working with you in the future. And we're going to have another off line chat about some things that I'd love to work on with you as well.
Yeah,
But
absolutely.
uh, thank you very much. And we'll see you next time because there will be a follow-up interview. I would love to go
Okay.
into some more things. We're going to do conspiracy at some point. That sounds like a lot of
Okay.
fun.
Okay.
All
Sounds
right. Well,
good.
you take care and we'll be in
You
touch.
too. All right.
All right, that's a wrap on today's episode. If you're walking away feeling like Medicare makes even a little more sense, then we've done our job. If you know someone who's turning 65 on disability or just completely confused by their options, send this episode their way. It could save them a lot of stress and potentially a lot of money. And Jared, thank you for breaking down this very confusing topic in a way that actually is usable for real people. If you want to connect with him, all of his information will be in the show notes. As always, thank you for being here, and I'll see you next time on Steph Thinks You Should Know.